I think the whole emotional side of treatment is really helpful. Learning to be more aware of your feelings, meditation, um, self awareness is really a critical part of it. Take a deep breath and try to find your center.
Tom, let's go into details about the symptoms you have with your ears and your hearing. You're here to help people, you're here to share your story. So, what are the first important points that you want to share regarding your ears and the symptoms you were going through? Essentially, what was going wrong? And then eventually, through this story, we'll tell what you did to fix it.
So my hyperacusis or the my tinnitus, I knew I had it, of course, and was always told there's no cure, just suck it up, and that's what we're all told. It wasn't until I read an article about tinnitus programs that were going on to relieve tinnitus, and Treble Health was one. It was the only one that didn't use some sort of an electrode in your mouth or on your wrist or surgery or pretty invasive thing. I felt pretty invasive things. So that led me to Treble Health to investigate Treble Health a little bit more. I had my hearing has been declining over the years. I worked in a woodworking shop for 30 years, and I ran a small farm, lots of tractor work, lawnmowers, lots of loud machinery. And I think my hearing loss and probably my tinnitus as well was caused by those excessive noise.
So, tell us next what happened over the years. I imagine for many years this wasn't really a big issue for you, but then things changed.
I think my tinnitus, as my hearing, as I got older, I'm 74. So as I got older and I started losing that upper range of hearing, I just thought it was normal. And when the audiologist finally said, you're borderline, you probably could benefit from hearing aids. That was just before I approached Treble Health, but they were just too expensive. I couldn't afford it. Well, I had insurance was covering it a bit, but so Treble Health, the maskers are hearing aids. So I said, okay, I can use the hearing aids as hearing aids after I go through the program, and I'll sort of break even. And that's really what set me on my path with Treble Health is I could afford it. I've had tinnitus for 25 years, maybe longer, because I didn't know I had it. So tinnitus wasn't my real problem. It wasn't the big problem. I had it. I didn't notice it until someone said the word tinnitus, and then I would notice it, and I could deal with it. Never bothered my sleep. I was never upset about it. When I heard that there was possible, it was the hyperacusis that really brought me to the program, and that's been dealt with somewhat, but most of the emphasis is on tinnitus. So that hasn't been the crux of my condition.
Great. So yeah, tell me more about that. What was the primary problem that we helped you with?
I think becoming aware of what the hyperacusis, I would just get angry when I would be in pain. It would make me angry. It would just make it worse. Coming to terms with my feelings of the noise itself, and then training my brain to accept those noises. I was clacking dishes and just listening. I had a decibel meter on my phone, so I could tell what decibel I was listening to. Listening to loud music for a certain period of time and doing that daily, that seemed to really help and becoming more aware of my emotions that were involved in the hyperacusis. And now I'm much more accepting of the loud noises.
And what were the symptoms you were dealing with at the time? What was the challenge of your ears at that time?
I'm a musician. I play the bowron. It's an Irish drum, and I used to play other instruments as well, but hyperacusis was just not allowing me to play anymore. It just was painful to play, painful to be in those kind of situations. So social events, any kind of background noise, I couldn't hear any conversation whatsoever.
So what advice would you have for someone who might be experiencing some sensitivity to sounds? Maybe they have some tinnitus, some hearing loss. What advice would you have for them?
I think the whole emotional side of treatment is really helpful. Learning to be more aware of your feelings, meditation, self-awareness is really a critical part of it. It helps you to be more accepting. It's all about accepting your situation, I suppose. You can change it. I think it's emotionally driven in some ways. the noise in your head, the sensitivity. So yes, self-awareness of what's happening to you in your brain, how you're reacting to exterior stimuli.
One of the most important things for tinnitus reduction that I've found is getting connected to a specialist that can identify the root cause and provide a treatment that matches the cause. In that sense, I'd highly recommend that you check out treblehealth.com. My team of audiologists are specialized in tinnitus and can provide a free consultation to you to help you get started on the right path. If you'd like to learn more, head over to treblehealth.com or click the link above right in the screen. And we got connected because you worked with our team at Treble Health. You were paired with an audiologist and had numerous sessions. You also had the sound therapy devices on your ears. Tell us more about how that went and the kinds of benefits to your sensitivity to sound, the hyperacusis, as well as potentially to your hearing or your tinnitus.
Well, I think my tinnitus, when I started using the maskers, I did find some improvement right away with the with tinnitus. Even though it wasn't a real issue for me, it wasn't something that was really bothering me. It did seem like that there were days when it wasn't gone. It's never gone, but it certainly varied more. It was less intense, and I found that stopping using the maskers was an issue as well, and stopping my noise sensitivity training. So having relapses is certainly possible. I think it's a continual treatment. You can't just stop. You can't just say, I'm cured and walk away. There's no cure.
This is something that we have to reduce as much as possible and then, have ways to manage it. Do you feel like the current status of your ears are in a place where you can manage it with earplugs, with being a bit cautious around very loud noises, with maintaining good health, sleep? Where are you currently at in that regard in terms of managing your current symptoms?
I think I'm in a pretty good place. Wearing earplugs, I have a pair of Eargasm earplugs. I think it drops the decibel level about 17 decibels, which makes life really tolerable in almost any situation. And I wear them when I go to a music session. I wear them certainly if I try to go to a movie or any kind of entertainment venue that's going to be loud. I'm at a point where I feel much more comfortable being in social situations, at jam sessions, whatever events I'm going to. Yeah, I'm able to go out and to those events now, and I wasn't able to before.
I love that. So your life changed because you're now able to be around noise in a way that's better. Using earplugs was a part of that strategically. Going forward with the hyperacusis treatment certainly helped. Any changes to your hearing ability? You mentioned that you had some hearing loss, correct? So did you notice any increased clarity of speech or words?
I think reducing the tinnitus has given me back that high frequency. The tinnitus was covering up when I went to see the audiologist and they had my hearing tested. My tinnitus was just roaring in my ears, and I couldn't hear those higher the frequencies that were the same frequency as the tinnitus. I couldn't hear it until it was loud, and that's where my hearing loss was, I think. So I think if I went to get my hearing tested again and it was a good day with my tinnitus, I think I would have a much better score. I haven't tested that yet.
That's a common concern that patients have is the tones you want me to respond to are a similar tone to my tinnitus. I don't know if this test is accurate. Well, there is a specific type of tone that any good audiologist should use when someone has tinnitus, which is called a warble tone. So it's essentially a frequency modulated tone. And that allows us to pick it up even if there is a baseline level of tinnitus. So for folks listening, have faith that your hearing test is accurate or within a very high confidence interval of being accurate enough for the programming of hearing devices, for example. So you explained that you had 3 conditions going on at the same time. You had hyperacusis, tinnitus, and hearing loss. Any advice for someone who has those same combination of symptoms?
I think what bothered me the most was the hearing loss and the steps toward getting the hearing aids and getting the tinnitus or the hyperacusis under control was really my reason for joining up at Treble Health.
Any advice for anyone else in a similar position? Just tactical how-tos on what to do on their own, or how to get started with their own education about what they can do?
I wish I had found earplugs years ago, really. I mean, I wear hearing protection whenever I was in a noisy environment, around machines. But I mean, that only covers up to a certain decibel. It's only up to, what, 29 decibels, maybe 32 tops. And the rest of the noise is just coming through your skull. So in social, I think if I was to, if I had known to use earplugs when I was in a social situation, I think that would have made a big difference in my life. So starting there is a great way to go.
Tom, I think your story is really important because you went to a local doctor. You were told there wasn't anything they could do for tinnitus. You didn't even know that hyperacusis, sound sensitivity, was a medical condition, that it was something that could be treated, or even that it was well understood. And you also had a hearing loss, and you're a musician, so you're very connected to sound emotionally and with your your work over there. So overall, I think your case is very important for those listening to recognize that even when you have multiple hearing conditions going on at the same time, that we can provide a treatment path that all these conditions can get better, and we can make sure to work on the things that are most important or the most crucial to you. So there definitely is something that can be done for hyperacusis, for tinnitus, and for hearing. Tom, I really thank you for sharing your story here. Do you have any last words for the community, messages of hope or positivity, or any last advice for those who need some wisdom?
Take a deep breath and try to find your center, and not be upset about the. I mean, I know that hyperacusis, not hyperacusis, but tinnitus can be it can come on very quickly to some people. Medication, there's many different causes of tinnitus, and there is a way to lessen the effect, but it has to come from you. It has to be a personal. It's not something that you're going to do for them. They have to do it for themselves through your guidance, really, and the audiologist there at Treble Health.
Thank you so much, Tom. Great to speak with you. And for everyone else listening, talk to you guys soon. Thanks for listening to today's podcast. I'm Dr. Ben Thompson, founder of Treble Health. If you need help for tinnitus and are looking for an effective solution, please reach out to our team. Head over to treblehealth.com or click the link on the screen right now, and we'll get you started with a free discovery call to help you on your path towards lasting tinnitus treatment.